Well, good afternoon, everyone. I think, Charles, it looks like we are live on YouTube's, and welcome to the June Kupuna Caucus meeting. I'm Representative Troy Hashimoto, and I'll be running the meeting today since Senator Moriwaki is not able to be with us. And I also have my House co-convener, Representative Takayama, Greg Takayama. Thanks, Greg, for being here with us.
Sure. Hi, Troy.
So I think we have some great presentations lined up for us today. I think just some quick updates. We are still waiting on the status of some of our bill signings from the governor. So continue to if you have some thoughts, be sure to convey them to the governor on our bills, especially the crimes against senior bill. We're hopefully that will be coming up in one of his bill signing ceremonies. And I saw a list come out today that he's holding signing ceremonies, and not for us at this point, but hopefully that will be coming out soon. His intent to veto needs to be coming out by the end of June, and everything needs to be signed by July 6th. So I think, hopefully by the next caucus meeting, we should have a better sense. And as soon as we know what dates, if there's a possible signing, we will be sure to let the caucus know. And I'm sure all of you have been tuning in to all of the governor's recent updates. There was a press conference today, if you didn't see, that announced some changes to travel policies. And one of the good things is if you're someone like me who lives on the neighbor island or wants to visit the neighbor island, those restrictions will be relaxed coming up on June 15th. And also you can come back from the mainland with just a vaccination card for those who were vaccinated in Hawaii. And of course, he set some benchmarks. So if there's 60% get vaccinated in Hawaii, then more people then others who are vaccinated outside of Hawaii can use their vaccination card. And then that 70%, his intention is to relax everything. So I think at least it gives us some incentive to get vaccinated. And I think that's the big push right now. And I think.
I'd like to ask you about that road work they're doing.
Okay, so I think hopefully we will continue to watch what those vaccination cases or numbers are within Hawaii, and then we can kind of adjust from there. And so I think there's some light at the end of the tunnel. So I think we should all be very thankful that at least there's a plan and we know what benchmarks we have to hit coming up. So continue to stay tuned. I know that at least conversations are starting to turn away from COVID and to other things. And so we as a caucus need to be focused on what issues we want to focus on. I think Senator Moriwaki and I are trying to rework some of the bills that died this past session and to make sure there's a better chance of them passing next session. And so I think we're going to focus at our July meeting on some of those issues. And so be sure to join us. We're going to have the insurance commissioner, I believe, join us, and maybe some other representatives who will have some input on the bill. So if you have any ideas on what you would like to see next year, please let us know early, because I think that is, again, our intention is to be sure to whatever the caucus bills get introduced. I think the intention now is that we've worked through a lot of the issues that may be questionable within the bill to make sure all the stakeholders know what are the components of the bill so that there's an easier path forward to passing some of the caucus bills that we put forward. And so we have myself, and I know Senator Moriwaki would say the same thing, and I know Representative Takayama are all here to work through those issues during the interim, because that's when we have the time to do so. So without further me talking, let's introduce our first speaker. We actually have the Executive Office on Aging, who is going to give us a presentation on the response that they've had during the pandemic and what they've been doing, and how I assume as we look forward, what we can expect. And so I look forward to seeing what you have to present today. So I'm going to turn it over to Caroline. Caroline, good to see you.
Good to see you too. Thank you so much, Representative Hashimoto. And I do want to also shout out to Representative Takayama. Today we had our Older Americans Month celebration. It was by I won't say by Zoom, it was by Olelo and their counterparts on the neighbor islands. And there is a schedule of when that's going to be replayed. So maybe Rick Tabor can give us that information at the end of this meeting under announcements. Thanks, Rick. It was a beautiful ceremony. The theme was communities of strength. And I think this pandemic has demonstrated that we are a community of strength, from leadership from the legislature all the way down to our volunteers in the community, giving of their time and effort. So thank you so much for everything that everyone does. It was a beautiful ceremony. I got a little teary-eyed, so I'll just stop there because then I'll lose track of what I wanted to share. Is it okay for me to share my screen?
I believe so,
can,
Charles.
right?
Yeah, go ahead. You should be able to.
Okay. Oh, hold on one second. Technology is always my friend. Let me go back here. I'll share my screen. Okay, but now let me just get it into presentation mode for you. Okay, today we wanted to share with everyone about our network's response to the pandemic. It's been in all my years in working in aging, this has been the most challenging year ever and I think that's evident in any line of work across the world because of the pandemic. Today, we're going to talk about our mission and core goals. We're going to be introducing Lindsay Iligan with the Hi-Fi with the Hawaii Public Health Institute, who's going to share about how the partnerships and the strength of partnerships. And then we're going to get into highlights at our statewide response to the pandemic, from the onset of the pandemic all the way through to the vaccination efforts that we've been doing in each of the counties. So that's kind of a highlight of what we're going to be discussing today. Oop, I think I went a little too far. Okay. Hold on one second. So this is a chart of, you know what, I'm going to minimize this so that it's not in my way of my screen. Okay. This is our Aging Network organizational chart. So we are funded through the Administration for Community Living. That's where our Older American Act funding comes from. The Executive Office on Aging is the state unit on aging. And then in each of our counties, we have our area agencies on aging, who are the designated leads in each of those counties. Again, we're very small but mighty in our partnerships. And that's why, as you can see through this slide, partnerships is so critical because we can't do it alone. Okay. The Executive Office on Aging's mission is really to optimize the health and welfare and safety of and independence of Hawaii's older adults and people with disabilities. And our core values are to ensure that Kupuna live with independence and dignity and maintain good health and quality of life. And never has it been more evident through this pandemic that these core values were threatened. You know, could people continue to live with quality of life and health because of what the pandemic brought to our Kupuna? So the core values, again, ensure that we live with independence and dignity. And again, those were really challenged during these times. Our area agencies on aging really are the boots on the ground. They are the leaders and trusted members within their communities, and they understand the unique challenges within their respective communities. If you talk to any of them, Kauai will say, we're very small, we have challenges, it's hard to find providers. You talk to Maui, they say, hey, I got 3 islands I gotta worry about, it's a tri-county. And then if you talk to Hawaii County, just the sheer size alone brings up challenges. So every county is very unique. Honolulu, we have the largest population, right? So that's some of the unique challenges that we have, but those also bring about great opportunities. Our area agencies know how to leverage and harness the partnerships and work with their stakeholders, and they can adjust to the changing landscape and the evolving needs of our communities during the pandemic. And at this time, because we really, the 2 takeaways we want from this presentation is to understand the uniqueness of each of our area agencies on aging, and also to understand how the network played such a critical role during this pandemic. So at this time, I'm going to turn it over to Lindsay Iligan with Hi-Fi, and she's going to share with us. And Lindsay, just go ahead and tell me when to scroll to the next slide.
Sounds good. Aloha Kako. My name is Lindsay Iligan. It's my first time here, so thank you for welcoming me. I am the Kupuna Program Manager over at the Hawaii Public Health Institute, or Hi-Fi for short. And so real briefly, I want to make sure I leave enough time for my counterparts to present, so I'll go through these pretty quick. But just a little bit about Hi-Fi. We're a statewide nonprofit organization centered around public health, unsurprisingly. Our mission really is to advance the health and wellness of the people and islands of Hawaii. And so we do that by expanding our understanding of what creates health of people in place, embracing upstream social, cultural, environmental factors, fostering partnerships, and cultivating programs. And so our programs range from food systems transformation to healthy eating, active living, oral health, tobacco control prevention, building the public health workforce, and so on. And so what does that look like? Or what do? We try to improve policies, systems, and environments where people live, learn, work, age, and play. And these are some examples of what that looks like on the ground. So I'm part of today's presentation because at Hi-Fi we have this unique privilege of being positioned to being able to contribute to the building of community power through the following actions. All of these things contribute to increasing our capacity of our communities to best serve our kupuna and meet their needs for health and well-being. And we'll provide a couple of concrete examples later in the presentation. But just as examples, we try to scale innovation, allocate resources to marginalized communities for that health equity response, providing backbone infrastructure for coalitions, providing technical assistance and training, and so on. And so, you know, the EOA and our AAAs have been critical leaders in our Kupuna-centered COVID response. But as they go into detail into some of the initiatives they were involved in, I'd like to suggest to you all some key tenets to community partnerships for you to consider. And even though each initiative in all the counties were highly tailored to its unique population, as Caroline was alluding to, you'll see a couple of common threads and cross-cutting themes throughout all of the work and our collective efforts. And so you'll see that this work was really centered around listening to the needs and gaps of our communities, identifying resources and opportunities where we could work together and have this collective impact, catalyzing opportunities and harnessing the strength and the enthusiasm of our public and private partners and partnerships. Innovation, being real creative and nimble and open to new approaches. You know, COVID-19 was new for all of us. So just being nimble and figuring out what works and being able to adapt. And also always keeping sustainability in mind. I know all of you here are decision makers and policy makers, and that's always on the front of our mind, right? Is how do we make sure everything we implement is sustainable? And so just committing over the long term, making sure we have that sustained engagement and contributing to resiliency so that we're better prepared in the future for any emergency events. So I had the privilege of working really closely through Hi-Fi with the Elderly Affairs Division at the City and County of Honolulu to quickly infuse federal dollars into the community to get meals into the hands of our kupuna and provide this backbone operational infrastructure for this coalition. It's called the Kupuna Food Security Coalition, and we're really centered around ensuring that no kupuna goes hungry or without the resources needed to age in place and live healthy, fulfilling lives. So we originally formed as a rapid response to the COVID-19 pandemic back in about March of last year. And we were really coordinating those emergency food security efforts, mainly on Oahu, but we have since expanded since then. You know, all of us, I think, we saw firsthand how the pandemic affected all of our lives, or, you know, affected everyone, all people of Hawaii, but probably none more than our kupuna, whose access to food became very limited, especially at the beginning of the pandemic, where there are stay-at-home orders and the grocery shelves are empty, and it was just really hard to get food onto the kupuna's tables. And so this is kind of a quick capture of some of the partnerships that we've made. We've since grown, but we have about 40 or so partners. We quickly mobilized and strategically distributed over 1 million meals to our kupuna in need, connecting them to health and social services to support or to make sure that their needs for well-being were met. And so as we enter this new normal of the pandemic, we continue to convene and leverage our partnerships and collective resources to work towards more long-term sustainable solutions. So this is a quick picture of some of the impacts we've made. This is actually outdated. This is collected back in December. So we've surpassed these numbers, but you know, over 1 million meals served, over 30,000 health and social services provided. We also linked thousands of kupuna with SNAP enrollment support. And we've served
mail.
And we've served over 8,000 kupuna each week at our maximum. And so this is just a quick glimpse of the impact within the first 6 months. So at the top, you'll see that we started to map out where the food insecurity was among our kupuna for Oahu. And you can see the difference just going from red to green, how many partners, really their community partners, stepped up and took on that role and leveraged their respective community networks to make sure that no kupuna fell behind or fell through the cracks. And as a result, we were able to disperse over $3 million of grant funds for direct response. And so to learn more, you can go to our website, it's hi-fi.org/kupuna. And we, as I said earlier, we continue to convene the Kupuna Food Security Coalition, and we're replicating this successful community-based model for other relevant kupuna needs, which my colleagues will go into more in their sections. And so with that, I will pass the baton on to Derek Ariyoshi. He is the county executive for the Honolulu Elderly Affairs Division.
Thank you so much, Lindsay. Really appreciate it. Caroline, perfect. Thank you. Beat me to it. Sticking to the theme that Caroline and Lindsay has already shared with us, which is the power of partnerships and the power of the aging network. Going to be consistent in that and sharing the strength of area agencies on aging, whether it be Elderly Affairs Division and my colleagues in the other counties, is that the power of the AAAs is that we are nimble, adaptable, in leveraging the unique attributes of our community. So in a lot of ways, the AAAs mirror the very communities that we serve. We look different, we serve different, but again, that's the strength of the aging network and the AAAs. Just appreciate the opportunity and the stage and platform to kind of share the community's work. Perfect example is the Show Aloha Challenge, is that in our role as a AAA, we saw opportunities in the communities, and it was in that we made the connections to make it happen. Show Aloha Challenge, what it was is that we had some amazing community leaders, Mike Gangloff, Lanai Tabora, who reached out to us early, saying that with our group of restaurateurs is that, we feel confident, Mike and Lanai, that we can generate community donations and funds and have restaurants produce the meals for kupuna. But what we don't know how to do and how to mobilize is how to get those meals out into the communities. And they approached the Elderly Affairs Division to kind of help bring all of that together. So again, testament to our community partners. What we did is that we reached out to Hawaii Meals on Wheels. Michelle Cordero Lee and team said, yep, absolutely. We'll get and take care of the distribution of those meals. Reached out to St. Francis Healthcare Systems, they stepped up as well, saying, you know what we can do is set up a call center in which family and Kupuna could call into St. Francis requesting meals, and that they would intake that and coordinate pickup of those meals and drivers by Hawaii Meals on Wheels at the restaurants, and then coordinate the logistics to deliver those meals to the homes of Kupuna. So incredible effort and demonstration of the power of partnerships. So over 20 restaurants participated, and over $1 million in private donations and funds from the community to support the efforts. Not a penny at that point of federal CARES funds, federal funds, city funds have reached the community at that point. So again, power to the community and partnerships. Next slide, Caroline. And again, oftentimes the role of area agencies on aging is making sure that we have an ears and pulse on the communities that we serve. In that, we heard pretty early on in the vaccination efforts that really the mechanism to get vaccinated was the online registration strategy, right? And we knew, because we had eyes and a pulse on the community, that a large part of our Kupuna population did not have the opportunity or capacity or ability to sign up for vaccine registration online. So in that, we had the honor of pulling together a cross-sector partnerships, informing what we call right now the Kupuna Vaccination Outreach Group, or KVOG. Caroline, if you don't mind, next slide. The power of partnerships again, right? Is that amazing organizations and individuals came together, each understanding and recognizing community challenges, but the unique attributes of each of our organizations that we can bring to the table and problem solve to support our Kupuna and get them vaccinated. Thank you, Caroline. And again, having a pulse on the community, we recognize what some of the barriers to have Kupuna get vaccinated, challenges regarding transportation, digital access and literacy, limited mobility, and quickly mobilized and formulated strategies on those unique attributes of organizations, and bringing all of that together. Some of the highlights that the community really supported was bringing vaccines into senior housing properties, working with our vaccine providers, coordinating with property managers, and just doing the linkages and logistics to bring those community attributes and resources to support our Kupuna again. Next slide. Just a quick impact data and information. Part of the community's work is to set up a Kupuna vaccine call center to receive telephonic inquiries from Kupuna, and setting up registration vaccination appointments via phone. So again, through some of those efforts, over 2,000 direct outreach to Kupuna, 500 referrals triaged to support Kupuna again. And in our low-income senior housing efforts, over 3,000 Kupuna at public housing were supported with coordination or logistics to get vaccinated. Next slide. With that said, again, I want to hand over the stage to Horace, Hawaii County Executive Director for the Hawaii County Office on Aging, and for him to share some of the good work that the community did on their island. Thank you.
Good afternoon. Thank you for this opportunity. I think my colleagues before me have really laid out one of the most important things that we learned was partnerships, and leveraging was a very important aspect that really came to the surface during the pandemic. And for us, when the pandemic hit, our first concern was, how do we maintain our core services? we still have our core services that must go out, but how do we do that? So with that, we had to, it's interesting when people say, think outside of the box, and you think outside of the box, but we're still bound by certain parameters that we have to stay in. So we're thinking out of the box, but still having to stay within the guidelines that we're charged with. And so some of those challenges came up, and one of it was with our meals program, and congregate meal sites were shut down. So we turned it around to get the meals out to individuals, but in that process, it drew heavily on resources. And in that process, it kind of impacted our transportation. First of all, transportation went down because people weren't going out, but then also the resources to get those meals out drew heavily. So some services we had to shift around. And those are some of the core services, but then there's also, I kind of call them fringe services. They're services that we do, especially in partnershiping with other agencies to get seniors their services, the kupuna that they look forward to. And one of them is, taxes. For our kupuna, to get that state refund that they're eligible for, the $110 or whatever, for them it's a big thing. And so it was very important for us that we continued that partnership. But when the pandemic hit last year, right in the middle of that process, we were shut down. And so it was pretty tragic or, heartbreaking for many seniors who did not get their taxes finished and they had to go elsewhere. But the thinking out of the box and leveraging partnerships we really came up as we partnered with ARP and our provider and us, and they came up with a drive-through tax service, right? So we could still implement the protocols for COVID and just thinking out of the box, and they were able to do 800 this year. And so it again shows the value of partnershiping and leveraging with other providers and with those in the network, because in some cases, government cannot move as fast as a private partnership, right? A private partnership has the ability to move a lot faster than government. Sometimes we may have the funding, we may have the capacity, but we cannot move as fast. And so we learned that it's very important to partner with our private partners and where we can help each other. And so that was a big lesson that we learned, that it's very important. So when we have capacity issues, if we are not able to move fast enough, our other partners have the ability to move. And I think that was demonstrated pretty much in this pandemic. On the next slide, we can see that some of the things that we wanted to address was social isolation, disaster preparation, and keeping them engaged through this whole process. And so, part of it was trying to get those kupuna who did not have a smartphone, try to get one in their hands and try to get them that opportunity to have them visual contact. But it wasn't only for social, but it also helped our case managers, because many times the families would not want people to come in, and we were short on case managers capacity wise. So it allowed the case manager to be able to get a visual look and verbal contact with the client, so that we could try to at least keep those services as much as possible running. We kind of wanted to keep them engaged, so we thought about these emergency preparedness kits, but then we broadened it not only for pandemic, but also we're in hurricane season now. So we wanted to get them thinking of whether it's a hurricane or any other type of disaster, what are the basic minimums that you should have. And so this kit was designed to help them develop a person-centered emergency plan and to give them an idea of these are the things that we should look at and what we should have available, and not to wait till the day that it's declared and then everybody's rushing down to Costco or whatever and trying to get their supplies. So trying to get them prepared. And then came up with a little training video on our website that walks them through that person-centered emergency plan that they could watch and help get developed. And then also we wanted to make sure we kept our volunteers engaged. For our volunteers, that's part of the most socialization they get. So under the COVID protocols, we set up so that our volunteers could still come and assist us and still look forward to that time of they got something to do, they can get out of the house. And we covered them to make sure that they were following all those protocols. And so those are some of the things that we were focused on addressing. In the next slide, you can see our Hawaii County vaccination rates. And I think this just came out, and Carolyn had forwarded to us. And you can see, I think on Hawaii, our county, we did very well. Our 75 plus population, 97% initiated the process, 84% completed, and our 65 to 74, 98% initiated, 82% completed. And I think that the success that we had with that really goes to highlight what partnerships and leveraging is all about. And the next slide, I just want to end with saying on our island, we were fortunate that Department of Health, Hawaii County Department of Health, and the medical centers, they took charge of the vaccination, the testing process, and they took charge and they were the focus of it. And so what that did was it freed the rest of us up to really fulfill the supportive role. We could focus on transportation, getting the seniors. I met with them and said, here, we have these housing sites. So let's schedule. And, Department of Health and the medical centers came up with from January to April, they came up with a calendar and they listed all the places, the housing units and everything, wherever they were going to be, the pods. And so everybody didn't have to guess or try to arrange their own. Everything was set up. And so we could then focus on getting transportation. Our office could focus on disseminating information and referring to they set up the centralized call center. So we would refer there. We would try to make sure that in everything that we did, whether it was a disabled placard that we gave out or our newsletter or whatever, we always sent out information disseminating about testing and vaccination and where they could get assistance and how we could help them. And so we even provided assistance to civil defense, who was providing manpower. Our office was able to provide an individual down there to assist them in some of their areas because we were not so stretched out in trying to cover all bases because they had it pretty much set up for us. And so I really appreciated Department of Health and the medical centers for taking that charge and coordinating with the pharmacies and all the different entities to get that. And so we were very fortunate, and I thank them very much. And so at this time, I would like to turn it over to our other counterpart, Kealoha Takahashi, who is the county executive for Kauai Elderly Affairs. Thank you.
Thank you, Horace. Aloha, everyone. For Kauai, like everyone has said, partnerships were really key in feeding our Kauai's kupuna. So we addressed food insecurities by collaborating and partnering with Malama Kauai, Hawaii Food Bank, Liliu Kalani Trust, Ainaho Kupu Kilauea, Namaka Ohana Ona, Local Farmers, Nourish Kauai, Kauai Independent Food Bank, Grow Farm Community Wins Program, and a whole host of other organizations as well. And key to our success was really leveraging the volunteers with the Kauai Retired and Senior Volunteer Program to deliver produce to elders in the community and to serve at soup kitchens and distribute food at the food pantries. Next. And also to address social isolation on Kauai through the utilization of federal resources and the CARES Act, we purchased 26 robotic pets. 5 puppies were placed and 2 cats with Kupuna, and they had to meet a certain criteria with feelings of depression, loneliness, and social isolation. And I just want to say we've had an overwhelming great outcomes with this program, especially from family members. One daughter reported that, oh, now she can, take a break and go to the bathroom or go and go to another part of the house without being called, and wondered where she was because her parent or her elder had a pet and that she could talk to. And it's amazing of the reaction that we see with Kupuna receiving this pet. So they do work. We also have purchase of 30 iPads. And this is for interested Kupuna needing to access enhanced fitness virtual classes, as well as caregiver training sessions, and then connecting with families. We also purchased 10 track phones like the Horace did, the burner phones, and this is to help connect family and to help our Kupuna connect with the healthcare provider. And then next slide. In our vaccination efforts, you have a picture here of the core staff that really help in assisting our Kupuna in setting up, scheduling their appointment, in disseminating information about vaccines, and provided personal support. Reporting from July of last year, 2020 to this year, this June, we logged agency-wide 9,708 calls, and of which those 4,598 calls were addressing food insecurities and COVID-19 vaccinations. So our associates really assisted in helping to schedule appointments for 1,628 Kupuna. And so one of the major, I guess, positive side about the pandemic is that it has really, gave us an opportunity to put our name out there. So whenever a Kupuna needed help, they were always referred to our agency. So I have a terrific team. Kudos go out to the team who have been dealing with Kupunas. And I just wanted to mention, out of all of the calls that we had, average phone call lasted over 50 minutes. So, besides just giving them information, I know a lot of them staff provided support and reassurance to our Kupuna that, that they're thought of and that we can get through this pandemic together. So it's been a really experience for all of us in the Aging Network. And most especially that to know that we're able to help and support our Kupuna in whichever way we can. So as a small part of what Kauai did and continuing on, Deborah is not here, so I'll introduce you to Kevin Dusenberry, who is subbing for Deborah today, and he is from the Maui County Office on Aging. Okay, Kevin.
Thank you so much. Thank you very much, everyone, for welcoming us today. I am in for Deborah. She wished she could be here. She's out, not feeling too well today, so I'll do my best to fill in for her. So our leadership team, the first thing that we really saw with this pandemic really was some food security issues, and we wanted to address that as best as possible. As my colleagues have shared, we also have really taken advantage of partnering with community agencies and other groups to really make that impact. The first real initiative was the Show Aloha Challenge. We, just like EAD shared with the Show Aloha Challenge, we partnered with them and really led the initiative here on Maui with 5 local restaurants to provide meals to participants. which in total was 15,611 in a short time period. It was only a few months. The nice part about that, as the Area Agency on Aging, we really weren't equipped to deliver that many meals as an office. We are a team of 25 when we're fully staffed. So we use that power of community relationships to work with local organizations like the churches, volunteer groups, and we're able to get those meals to the people that needed them most, our oldest adults and people with disabilities. In addition, we purchased meals ready to eat, and in total 14,400 meals were purchased prior to the start of hurricane season last year as well. So it was a twofold opportunity for us. It provided the food security to our older adults, but also in preparation for that hurricane season, they were able to have those meals. They were provided 5 meals per an older adult per household. Since they do have a nice shelf life, we do have extra meals left over for this hurricane season, and we'll be distributing those here pretty soon. Also, because of the ongoing pandemic, we increased or expanded home delivered meals to an additional 962 participants. That's in addition to the normal 1,500 on average that we serve in 1 year. To a total of 120,031 meals. So those we're going to, and still continue to go to, those people that have called us and said, hey, I really don't feel safe going outside of my house right now. And also to those that attend the congregate meal sites. Next slide, please, Caroline. One program that we are extremely proud of and excited to talk about is our Feeding Maui Nui, Aloha Plates to Go. All about those partnerships, we partnered with the Maui Food Technology Center. And this is an innovative response to help those over the age of 60 that really are needing some food security. And really what happens with this program is participants will call us and we do a brief assessment over the phone. If they're eligible, we mail them vouchers to redeem at any of the participating food trucks across the county. Right now, we have 31 participating vendors. They are mailed a list, but we also have an interactive map on our website so they can find the closest food trucks to them. One of the greatest benefits truly of this program, in addition to that food security, is really having that positive economic impact on local food truck vendors and the food suppliers, especially last year when we started this program. The economic stability was so dire for almost everyone. So it really was a great program and we're excited to continue it today. Next slide. Thank you. In addition to food security, addressing social isolation is incredibly important to us and all the other AAAs across the state. Like our friends on Kauai, we also purchased Furry Friends. We have to date had 54 successful adoptions. We purchased close to 200 Furry Friends, and we are in the process of still identifying those individuals that would benefit from the program. We are excited to share that on an initial study of those that have been reassessed upon the 45-day reassessment, a 47% reduction in the negative health outcomes of social isolation. We're excited to really share more once we get the next set of reassessments done. Our care managers have also been focusing on enhancing our telephone reassurance, making those phone calls. Our phone call volume has tripled since the start of the pandemic. We have steadied out a little bit since our vaccine rollouts, but we'll talk about that here in just a short minute. Another exciting program that we kicked off with the Alzheimer's Association is the Care Notes of Aloha. We found that even though with our uptick in our extended outreach with telephone reassurance, sometimes older adults may not really feel that sustained benefit of a phone call. So we, with one of our program specialists, partnered very closely with Alzheimer's Association and helped to deliver 1,215 Care Notes of Aloha to residents of Halemahaolu, Halemakua, the skilled nursing facilities across the island. It really did just really increase the mood and overall cheer of those recipients. It was a very positive impact. We also have a virtual enhanced fitness program that's ongoing. Because of the pandemic, we had to close our centers where those normal in-person classes are held. And we were receiving feedback from the instructors that people really were missing the engagement, missing that exercise. So we have partnered with our enhanced fitness instructors to create videos that are posted on our website and also available on Akaku 3 days a week to watch and really participate on your own leisure. We are in the process of also retrofitting a room at the Cameron Center here on Maui where participants will be able to participate in the true enhanced fitness program. We're hopefully going to start that in July. Lastly, on this slide, carport visits. We have also been using this as a way to stay safe and engage with our participants. Our care managers will go and visit with those people that are really just feeling the effects of the pandemic, but also maintaining that safety during the COVID-19 pandemic. Next slide, please. Thank you. In regards to vaccinations, we really did focus on wanting to be the one-stop shop for older adults for vaccines. We helped register older adults for their vaccinations. They essentially would call us and our care managers would log in to one of the partnering agencies with the Department of Health to get them registered for a vaccination event. Currently, we did identify and assist 1,272 older adults. That also includes those who required in-home vaccinations. So for those that could not get out of their homes, we basically helped with the additional help of the Department of Health, deployed a team out to those homes to get those people their vaccinations. One benefit of the pandemic is we've been able to create these new relationships, one of which is at our local MEMA, and we were able to obtain access to Everbridge, which is an automated polling and notification system that is typically used for disaster preparedness. In this case, we used it to monitor vaccination status, and we do have and plan on using this technology to prepare our participants for the upcoming hurricane season. We also found and identified a intergenerational project opportunity with Seabury Hall and Maui Health Systems. And you can see in the photo to the right, this is a photo from that event where high school students and our MCOA staff helped older adults sign up for their vaccination appointments. And one other opportunity that we saw from all of this is that people were calling our office looking for help. So in addition to helping them sign up for vaccines, we did also look at what other services they may benefit from. So a lot of them also were looking for home delivered meals. And if they weren't eligible for that, they are now happy participants at our food truck sites. Thank you so much.
Thanks so much, Kevin, Horace, Kealoha, and Derek. In summary, I just want to share that I think you recognize that all of our area agencies on aging and leadership at VOA are very valued and critical partners with the infrastructure to support responses to the pandemic. Again, the AAAs have that uniqueness about each of them, and they have the knowledge to support their communities in every way they see fit. This does serve as a model for any future emergency responses, hopefully not in my lifetime, but will help to model future responses that we may have. We've also learned to be flexible. We've enhanced our partnerships. We've learned to support each other more than we have in the past, I would say. And we really leveraged all of our resources from federal, state, county, and the philanthropic funds that were infused into these efforts. So with that, I'd just like to thank everybody and hope that there's bright rainbows ahead for us as we get out of this pandemic. Thank you.
No, thank you, Caroline, and thank you to your entire team for doing that great presentation. I think it was very informative, and I think we kind of knew some of what was going on, but I don't think we really understood the whole depth, right? It's hard to know everything that's happening. So wouldn't expect any less from you folks, but thank you for all of your hard work, and be sure to keep that handbook in the file cabinet, right, for the next time. Hopefully, again,
Yeah.
not anytime soon.
Not anytime soon.
At least we have the handbook, though. So we have one more presentation real quick today, and then we can open it up for some questions and announcements. But I did want to introduce, before that, we do have Senator Joy San Buenaventura on the call today. Hi, Senator Joy. And I think there's also one of my other colleagues, Lisa Martin, who's on here today. So thank you, Rep. Martin, for being here as well. And I think that's it for today, but we also have a presentation from the Alzheimer's Association. So I think Ian Ross is supposed to be on with us to discuss some dementia issues. So Ian, if you're here, or anyone from Alzheimer's, yeah, go ahead.
Aloha, Representative. Thank you for recognizing me. Yes, I'm really happy to introduce our programs manager for Maui, Christine Spencer, who will be presenting on the 10 warning signs of Alzheimer's.
Thank you, Ian. And thank
Pardon me,
you.
I think I'm...
Hi, Ian. Thank you so much for the introduction. Thank you, Rep. Hashimoto. And a special thank you to our Office on Elderly Affairs. I'm Christine Spencer. I work closely with the Maui County Office on Aging. I'm the Maui representative, and personally, you guys are amazing. We do a lot of referrals to you, and thank you for all the work you do and for your presentation. So today, I know I don't have very much time, so I'll move pretty quickly, but thank you for having us. Today, I want to talk to you about two different things. First of all, I'm going to share some of our local services and resources for those of you who don't know, so you can let families know what's available to them from our Alzheimer's Association. And also, I'm quickly just going to share some warning signs and some dementia tips to you folks. This month is Alzheimer's and Brain Awareness Month, the month of June. So we're really trying to, promote brain health, talk about different issues when it relates to dementia, and really support all of our caregivers that we have in our communities. Right now, Alzheimer's disease affects 5 million people in the state of Hawaii. It affects close to 30,000 people with the disease, but we know that this disease affects the entire family, not just the one person. And so there's also over 60,000 caregivers that we have in our communities here. So our association, we do a lot of different resources. Everything, of course, is free to families because of the generous support we get from our community. But one of the core programs we have, it's our care consultations, where we can speak to the person with the disease or their family member, their caregiver. We answer any questions they might have. It's a 30-minute phone call, and we can help them plan ahead for the future, or really just give them any information that they need about the disease. We offer a 24/7 helpline. This has really been good during COVID, because people can call instead of going, to the hospital or something like that when they have a crisis. A lot of times we saw people call our helpline, and it's available off hours, which is a great resource for folks. So please share our helpline with anybody that you think may need it. We offer a lot of different education programs for professionals, for caregivers, and even for the general public as it relates to brain health. We offer support groups on every island. There's a support group running probably every week of the month. And I'll share a little bit about where you can find more info. But a big bulk of our work as well is working with our amazing community partners on every island and doing that information and referral, really connecting families to all of the other great local resources that we have in our communities. So as I mentioned, the care consultation, if you ever want to refer somebody, you can call our office anytime. Our helpline is staffed every day, 24/7. That number is there. And then all of our programs right now are online, but we will be doing some in-person things later in the year. All of these can be found on our website, alz.org/Hawaii. for all of the list of classes and where to register. And as well, our support groups are offered online, but folks can also call in as well. So during the pandemic, we really had to make a big transition, as a lot of our partners did. But we actually found, as we've heard from our previous presentation, we found a lot of silver linings through it. And we were easily able to rapidly transition all of our programs to virtual, to online. We've got a lot of online resources that were already available. We performed wellness calls to hundreds of people on our database list. And we really took the time to train volunteers and folks to get online. And I have this picture here of one of our wonderful participants who is in her 80s and getting on Zoom for the first time. So it's really been exciting in that sense. But we really try to take the time to make sure we can reach those folks. And we had seen that our numbers are actually increasing. And there's, a few different reasons for that. But I think because caregivers are able to get support and get these classes from home, they don't have to leave their loved ones. It's actually been more accessible to them in a lot of ways. I think we'll keep offering this to a certain extent, but just a summary of what we've done through your support is we have served over 2,000 families. We've done almost 100 classes online last year, and then we do have support groups. We hosted close to 100 of those. So now I'm going to jump into a little bit, and I won't take too long, I know we're running on time, but a little bit about the warning signs, just in case you might have any questions for yourself or for somebody in your family. I know a lot of times it's hard to decipher what's normal aging and what could be a sign of Alzheimer's or dementia. So I'll just briefly go over what is dementia and what does that word mean? Because a lot of times we use it interchangeably, with dementia or Alzheimer's disease. And dementia is really just a general term. You think of it as an umbrella term, and it really defines a lot of different brain diseases with some similar symptoms. So you've probably heard of Parkinson's disease, vascular dementia. You can see on the slide, there's a range of different dementias out there. Alzheimer's disease is the most common by about 70 or 80%. That may be why there's the most information and research behind it. But we do see a lot of numbers increasing with other dementias as well. So that's just, if you hear the word dementia, that's what it means. And sometimes we say dementia when somebody doesn't have a proper diagnosis or a formal diagnosis for what they may be experiencing. So what is Alzheimer's disease specifically? I will just really give you a simple explanation of what happens in a not scientific way, just so you kind of understand. But if we think about our brain, which we don't always because it's tucked away in the back of our heads, what happens in there is there's tons of different connections. They're almost like tree branches, right? And all of these billions of neurons need to communicate through these receptors. There's something that happens when somebody develops Alzheimer's disease. They develop some abnormal plaque or amyloid protein buildup in these tree branches, so to speak, right? And so what this means basically is this plaque buildup prevents those neurons from being able to communicate to each other. And then they'll start to die, start to lose muscle tissue, and the brain will start to be damaged and start to shrink in some cases. So that's just a very non-scientific way to let you know kind of what's going on and how we can see this in the brain now through different ways of diagnosis. I'll share also briefly. But let's get into some of these warning signs and why it's really important to know. First of all, we know that memory loss is something that's very common as we age. So today we're just I'm gonna share quickly a few little nuances that may show why it could be normal or why it may be a warning sign. So the first thing is, of course, memory loss. And this is something that happens to a lot of us. But what is the little difference between somebody who may be experiencing Alzheimer's disease or dementia is we see them repeating the same things over when it comes to memory. They may forget some important dates, and they may constantly need reminders. So we see that their memory needs a little bit more support. We know that it's natural to forget things as we get older, but we usually can recall that information. I usually give the example of a lot of times when you walk into a room and you forget what you walked in there for, sometimes you can walk back out and you'll remember what it was you were looking for. Somebody who's experiencing Alzheimer's or disease or dementia, they won't have that ability anymore to recall that information that they just lost. It really affects the short-term memory first. So that's what we see, and that's a slight difference. I hope that you can understand. The next one we see is problems with planning, and it really shows in finances and numbers. So this could be somebody that you notice maybe their taxes weren't paid or their bills are piling up. This could be a sign that they may be having some problems with these small financial things that they didn't have before. And I just wanted to mention, when we talk about these warning signs, we have to really relate it to the baseline of the person, right? There's people that aren't always good with their finances to begin with, so this may not be a sign for them, but somebody who's really meticulous about their bills, and we start to see something like that slip, that's when we might think of it as a warning sign. A next one is difficulty completing familiar tasks. And this really means that when we see somebody struggling or taking a much longer time doing something than they used to have done it, that could be a sign. And a lot of times we see this with driving, when somebody may be driving and they get lost. We see this when somebody may not really be able to play a card game that they used to play before. So this is when we start to see a change, and the daily things are becoming a little bit more times slower, it says here technology, and that is normal, but this is a slight difference in that. The next thing is confusion with time or place. And what this really means is when somebody may not be aware of what's happening right in front of them. It may not be something they can understand. And a lot of times this can be because of their brain's processing time, or maybe there's a lot going on and overstimulating them. But this is really when you notice that somebody is confused with where they are and how they got there. When we retire, some of us, we may be confused with what day of the week it is, but this is a slight difference where we see that confusion of how they may have gotten somewhere. The next one, we're halfway there, guys. I'm trying to move so quickly. The next one is we see, and this is a very interesting one that a lot of research is starting to look into now, is we're starting to see that people, a warning sign for Alzheimer's disease is that people are having issues with seeing. And it's not so much, that their vision is declining, but it's the spatial relationships. It could be color and contrast. Early on, we may see people who react differently in the passenger seat because they may be having issues with their vision. And so we know vision changes with age, but this is the slight difference, is it spatial relationships and sometimes contrast. Number 6 is language. And we see early on, the part of the brain that's affected, the cerebrum, is the part where we have our language skills. And so this is what we see early on, is people may withdraw from conversations. They may repeat the same things. They may not find the right words, really struggle with that. And they may sometimes just make up a word for something. And so this is when we see that there's problems with the language that could be a sign. We forget things all the time. When we speak, we forget the word or the place we went to, right? That's pretty normal. But this is when somebody is really stopping in the middle of the conversation and really, really struggling. Number 7 is misplacing things and not being able to retrace those steps. So a little bit like what I mentioned before, is that short-term memory is really been affected. And so that can be really difficult. Always misplacing things sometimes can be very chaotic if you experience this in your family. And what we see with the disease specifically is because the person who's going through this disease is so terrified, you can imagine, is sometimes they may accuse, it may be a coping mechanism to accuse others, or even become more paranoid. So this is something to look out for as well as a warning sign. Decreased or poor judgment. We think about this when it comes to money, but also when it comes to hygiene. So if you notice that somebody may not be taking the best care of themselves in certain hygiene areas, this is when we start to think that it might be a sign. And then number 9 is we see people start to withdraw from activities, really because of, as I mentioned before, those language skills get impaired. It becomes very difficult for them to keep up with conversations. And a lot of times, you can see this sign if you have somebody who has been very, very social before, and now they've changed and they don't want to go out as much, or they're withdrawing as more. And so we might know that this is a sign for that person. Sometimes, as we age, we're not always interested in the same things. But it's really looking at more of the social element of the person's life and how that's changed. And our last one really is looking at somebody's changes in mood or personality. As we know, as I mentioned, this is a frightening disease for somebody who's going through it. So if we start to see some changes in mood or personality, they may not articulate to us that they're feeling memory loss that's scaring them. But if we notice that they're becoming more frustrated or depressed, it's a sign that we might want to talk to them about some of these issues. So very quickly, that is the 10 warning signs. You can find them on our website with a little bit more elaborate definitions of each one and examples. But just I'll quickly move along because I know the meeting is adjourning soon and there's other things on the agenda. But just so you know, our association has tips if you need to speak to somebody in your family about this or about the warning signs. We can lead you through some easy steps that you can see here on my screen. But really just thinking about who should be involved in the conversation and offering to go to the doctor with this person if you're really concerned. Of course, you can always turn to us. And I just wanted to mention quickly, it's really important to see the doctor and make an early diagnosis or detect what's going on with them, because it's not always Alzheimer's disease. We know this disease affects 1 in 3 seniors, but it could be anything. It could be cancer, it could be anything going on with them. So it's really important. If you go for your annual wellness visit with your primary care physician, they could do a mini brief cognitive assessment, if you haven't heard of that yet, which is just a very quick test where they can assess some of those cognitive abilities. So there are many different ways to get started in working on finding a diagnosis for somebody, but it's just really important to start the process so you know what you're dealing with and you can really help improve somebody's quality of life. So I'll go ahead and turn it over. I mentioned, please check our website. This is Brain Health Awareness Month, Alzheimer's and Brain Health Awareness Month. So we've got a lot of fun classes for the general public on brain health. And we also offer classes at work. If you know any caregivers in the workplace, please reach out to us. We also have our longest day coming up in June and save the date for our walks this year. We could not do our work without the people who support us, who have donated, who have been to our walks. I know Rep Hashimoto has been to our walks before. So thank you everybody for all of your time today, for listening to us. If you ever want to volunteer, please reach out. But thank you again very much. If you have any questions, please feel free to call me anytime. I really appreciate your time this afternoon. And thank you very much.
Thank you for that great presentation. Very, very informative. I think that's, it's good to have, and as we interact with our loved ones. Maybe Christine, you can maybe put your email in the chat, and maybe Caroline do the same. If anyone has questions, since we're kind of running out of time, that they know that they can just email you directly and get whatever concerns that they have or questions out directly to you. So anyone who has those questions, please feel free to reach out to Caroline or Christine, and hopefully they'll get back to you. I do want to recognize Representative Ryan Yamane, who's also on the call. So thank you, Rep Yamane, for being here. He's the chair of our Health and Human Services Committee in the House. So I really appreciate him taking time out of his day. So we're about at that time. I think we've gone a little bit over today, but I think it was well worth it to get all this information from both organizations. But before we end today, I did want to open it up for any announcements from the group. So if anyone has any announcements, now is your chance. Okay. I know Rick did put in that information into the chat box that for the upcoming events for the rebroadcast of the Older American Month on Olelo. So just make sure you take a look there if you are interested in watching that replay. So If there's no other announcements, any announcements, last chance? Oh, go ahead, Ian.
Representative, I just want to let you know, Christine wonderfully mentioned that we have a number of programs in June, including different groups. I went ahead and included that schedule in the chat for anyone who's interested in seeing more.
Wonderful. Thanks so much for doing that, Ian. And so we have a full agenda for July as well. But in the meantime, if you folks have any questions or concerns, please feel free to reach out to myself or Rep. Takayama or Senator Moriwaki. We'll try and get any of those addressed, and especially if it's legislation, we want to get that addressed sooner than later. But if not, we will see you in July, and look in your emails for all the Zoom information. So thank you, everyone.
Thank you.
Bye.